So what are the hallmarks of an aging face, and how can we use dermal filler to help? So the first thing that happens as we age is that the fat pads in our face shrink and get smaller, and they sink with gravity and they drop. When we're younger, we have something called a triangle of youth, where we're more full at the cheek area, and that fullness tapers and diminishes towards our chin. Now, as we age, that triangle inverts and we become thinner at our nose, and we have the sunken eyelids, and then we have fullness down towards our jowls and towards our chin. So we can use dermal filler to correct these things and restore the appearance of youth. Now, dermal filler is a hyaluronic acid-based gel, and the properties of that gel change depending on what area of the face we're looking to treat. For instance, if we want to use filler to approximate a jawline, we need to use a pretty strong filler that has a property, almost a bone-like quality, and we inject that around that jawline area to give definition. Now, some of the fillers, for instance, on the other hand, that we would use for the lip are very soft and malleable to give a different sort of texture and style. The most common areas that we treat with dermal filler is the cheek area, and that's because of those fat pads decreasing in size and dropping. So usually just a little filler in the cheek area can lift that area and restore the appearance of youth. A lot of times the cheek definition ends up softening as we age, so we can always add a little bit of filler there to create that defined chiseled look. The other area that is nice to treat after the cheek area is treated is called the nasolabial fold. That's the line that we get from the nose to the mouth that becomes a crease, and adding just a little filler behind that line can create a softening. Similarly, many women and men have a line at the corner of their mouth towards their jaw called a marionette line. Again, adding filler just behind that area of the face can create a softening of that line and an easier transition so that our face doesn't look like it's a chiseled or a hollowed mark at that area.